Good day everyone, I'm Justin M. Castillo, a student nurse of Davao Doctors College. I'm going to perform how to properly assess thorax and lungs. Previewed clients' previous medical records and doctor's order sheet. Determine the scope of assessment. Prepare necessary equipment. No. Perform hand washing. Don gloves if deemed necessary. Greeted the client politely. Introduce self and verify the client's identity. Ask how the client would like to be called during assessment. Establish rapport with the client. Explain procedure to the client and how he or she can participate during assessment. Provided the client the opportunity to clarify, ask or raise any concern. Ensure client's comfort, privacy, and confidentiality. Assessment setting was assured to be safe, secured, and free from distractions. Position client to sit and comfortably. In a moment, drop an anterior thorax when it's not being examined. Good day, sir. I'm Justin, a student nurse for today. Can I ask your name and birthday?
My name is Kurt Jester Bourbon Reyno, and my birthday is January 17, 2002.
Kung sa gusto ni mo nga tawag ako sa iyo mga sir.
Burnok lang.
Ayaw ka bala ka sir. Kaya na to storyahan ka ron sir. Kaya confidential ka sir. Sir, pwede na ako isado aportahan sir.
Yeah.
Check for signs of respiratory distress and the problems with oxygenation. Observe color, face, lips, and chest, and fingernails. Palpated, suppressed notch, and noted the versions of the trachea. Sir, nagainom ba ka og alcohol, sir?
Wala man.
Or nagayusi, sir?
Wala sad.
So, kuan, sir, nakakay family history, sir, sa cancer?
Wala po.
Examining the posterior thorax and lungs. While the client stands with arms on the sides, stood behind the client and observed the position of scapulae and shape and configuration of the chest wall. So first, we need to inspect the symmetry of the thorax from posterior to lateral view and compare it from interior diverse and transverse diameter. So sir, pwede na matindog, sir. So the thorax is symmetric. Inspected the spinal alignment for deformities. From a lateral position, observe the three normal curvatures, cervical, thoracic, and lumbar. To assess for lateral deviation of spine, observe the standing client from the rear. Have the client bend forward at the waist and observe from behind. Now we're gonna inspect for the spiral alignment for deformities. Observe the normal curvature sa cervical, thorax, and lumbar. So, ito mo sir. So, the spiral is normally aligned. Palpate the posterior thorax. Assess the temperature and integrity of all chest skin. Palpate all the thorax areas for bulges, tenderness, or abnormal movements, especially for clients who have respiratory complaints. Next is I'm going to palpate the posterior thorax. So normally, no swelling and tenderness. Palpate the posterior for respiratory exertion. Place the palms of both your hands over the lower thorax with your thumbs adjacent to the spine and your fingers stretched laterally. Ask the client to take a deep breath while you observe the movement of your hands and any lag in movement. Next, I'm going to palpate the chest and the posterior chest for respiratory. Tingnan natin, sir. So as you can see, my hands are moving. Through the chest wall when the client speaks. Place the palmar surface of your fingertips of the ulnar aspects of your hands or close first of the posterior thorax, starting near the apex of the lungs. Ask the client to repeat such words as blue moon or 1, 2, 3. Repeats the two steps, moving your hands sequentially to the base of the lungs. Start toward the midline at the level of the left scapula over apex of the left lung. Then move your hand left to right, comparing findings bilaterally, move symmetrically downward and out to cover the lateral portion of the lungs at the bases. Compare the primitus on both lungs and between the apex of the base of each lung, using either one hand and moving it from one side of the client to corresponding area of the other side, or using two ones that are placed simultaneously of the corresponding areas of each side of the thorax. Now I'm going to palpate the chest for the vocal remedies, so instead of using my right hand, I'm going to use my both hands. Sir, moingon ka glue muna or 1, 2, 3.
Blue moon. Blue moon. 1, 2, 3.
Percuse the posterior thorax. Ask the client to bend the head and fold the arms forward across the chest. Percuse the intercostal space at about 5 cm intervals in a systematic sequence. Compare one side of the lungs with the other. Percuse the lateral thorax every few inches, starting at the axilla and working down to the atrium. Measure the diaphragmatic excursion. Use percussion to identify the level of the diaphragm and measure the diaphragmatic exertion. Percuse downwards from above the expected level of diaphragmatic dullness until dullness is definitely heard. Mark the level of full expiration. Had the patient inhale deeply and hold it in, then percuse downward to the level of dullness and full inspiration and mark it. Repeated this process on the other side. Measure the distance between the expiratory and inspiratory levels of dullness. Next step is I'm going to percuss the thorax and then percuss the diaphragmatic exhaustion. Auscultated for breath sounds. Place the diaphragm of the stethoscope firmly and directly on the posterior chest wall of the apex of the lungs at C7. Ask the client to breathe deeply through the mouth for each area of oscillation. Using the systematic ladder pattern used in the percussion, listen at each point to the breath sound during a complete inspiration and expiration. Compared findings at each point with the corresponding point of the opposite side of the thorax. Note the location on the chest wall where adventitious sound are heard, as well as the location of such sound within the respiratory cycle. Osculated voice sounds. Bronchopnea, the client to repeat the phrase 99 while auscultating the chest wall. Igaponi. Ask the client to repeat at the letter E while listening over the chest wall. Whispered Perchoroloquy. Ask the client to whisper the phrase 1, 2, 3 while auscultating the chest wall. Next step is I'm going to auscultate the chest using the diaphragm of the stethoscope. So sir, lag na ko inhale, exhale sir ha.
Okay.
So the findings are normal. Assessing the anterior thorax. Inspected breathing patterns. Inspected the costal angle and the angle at which the ribs enter the spine. Palpate the anterior thorax. Using your fingers to palpate the tenderness and sensation, starting palpating with your hands. Positioned over the left clavicle and move your hand left to right and comparing findings bilaterally. Moves your hands systematically downward toward the middle line at the level of the breast and outward of the base to include the lateral aspects. The repeats of the sequence is palpating for cryptus and permittus in the anterior. Palpate anterior thorax for respiratory excursion. Place the palms of both your hands on the lower thorax with your fingers laterally along the lower rib cage in your thumbs, along the costal margins. Ask the client to take deep breath while you observe movement of your hands. We need to inspect the breathing pattern. So I've observed the breathing pattern of the patient is quiet and it has effortless respiration. Next, we're going to palpate the anterior chest. Now we're going to palpate the anterior chest. It is usually quiet normal, then going to palpate the anterior chest for the respiratory. So it is normal. Percuse the anterior thorax or systematically. Begin percussing above the clavicules in supraclavicular space and proceed downward to the diaphragm. Compare the lung on one side to the lung of the other side. Displace female breast to facilitate percussion of the lungs. Auscultated for the anterior breath sound, adventitious breath sound, and voice sound. Auscultated the trachea. Auscultated the anterior thorax. Place the diaphragm of the stethoscope firmly and directly on the anterior chest wall. Auscultated from the of the lungs slightly above the clavicules to the base of the lungs at the sixth rib. Ask the client to breathe deeply through the mouth in an effort to avoid transmission of sounds that may occur with nasal breathing. Listen at each site for at least one complete respiratory cycle. Listen for the normal breath sound and adventitious breath. Follow the systematic ladder pattern. So I'm going to percuss your anterior chest. So it is normal. So I'm going to osculate your anterior chest. So it is normal. So next, I'm going to osculate the trachea using the stethoscope. So it is normal. Summarize in closing phase. Summarize the information obtained during the working phase and discuss. Finding to the client. Discuss with the client possible plans to resolve health concern if present. Assess for client's understanding of the plan and the need for further teaching. Provide the clients the opportunity to clarify as raise any concern. Thank the client and ended the interview politely. Done after care performed hand washing. Document findings in the client record using printed or electronic forms or checklist supplemented by narrative notes when appropriate. So sir, naman itong assessment. So thank you sa pag-cooperate sir.
Thank you po.